Hello everyone, welcome to 10-Minute Physiology. In today's video, we're going to be talking about intrapleural pressure. So with that, let's give it a go. So I would like to start off by describing to you something called elastic recoil. So imagine you have a spring, and you pull the spring at both of its ends. Now whenever you stretch a spring, this causes elastic forces to build up in the spring. So when you let it go, the elastic forces act on the spring, bringing it back to its normal position. So these forces that bring a spring back to its original position is called the elastic recoil forces. So a lot like a spring, our lungs and chest cavity also have elastic recoil forces. So our lungs have elastic recoil forces that point inward, and the chest cavity, which surrounds the lungs, have elastic recoil forces that point outwards. And it's the interaction of these two opposing forces that generates the intrapleural pressure. So in between the chest cavity and the lungs is the pleural sac. So the pleural sac is sort of like a balloon that is wrapped around the lung. It's a double membrane where it has both a parietal and visceral membrane, and it's wrapped around the lungs. And the pleural sac also has inside of it intrapleural fluid, and the fluid fills the intrapleural space. So this is the intrapleural space, and it's inside the intrapleural space that we have the intrapleural pressure. So remember, it's the interaction between both the elastic recoil forces of the chest wall and the elastic recoil forces of the lung that generate the intrapleural pressure. So what exactly is intrapleural pressure? So if we were to look at a person in a standing position, what you would see is that inside the intrapleural space, you would have a number of different pressures. So the first thing to consider is that in this person is in an atmosphere where the barometric pressure is 760 millimeters of mercury. And let's just assume that the pressure in the alveoli is going to be 0 millimeters of mercury. And we're going to talk more about this in a later video. So what would be the intrapleural pressures here? Well, the intrapleural pressures would depend upon whether the person is standing, laying down, or if they're maybe upside down. So if the person is standing up, the force of gravity is pulling the lungs down to the floor. So as a result, the pressures on the top of the pleural space here would be different from the bottom. So because the lungs are being pulled down by gravity, the pressure at the top of the intrapleural space is going to be less than the pressure at the bottom of the intrapleural space. So what we can see here is that the pressure inside the intrapleural space can vary depending upon whether the person is standing or on top of their head. So if the person were upside down, the opposite would be true. In this case, what would happen is that the force of gravity would be acting at this point. Therefore, at the base of the lung here, you would have the lowest pressure, and at the apex here, you would have the highest pressure. So remember, it's the intrapleural pressure is going to depend upon whether the person is standing, laying down, or upside down. So how can the intrapleural pressure change? Well, the intrapleural pressure can change mainly through the actions of different respiratory muscles. So the primary respiratory muscle of inspiration will be the diaphragm, which is what we're going to talk about first. Then we're going to talk about the intercostals. So what does the diaphragm do? Well, let's just take a look at our chest cavity, and at the bottom here we have the diaphragm. So the diaphragm is innervated by the phrenic nerve, and when the diaphragm is stimulated, this causes the diaphragm to move down 1 centimeter. So it's the contraction of the diaphragm that brings it down. So when the diaphragm contracts, it goes down, increasing the volume of the chest cavity and therefore decreasing the intrapleural pressure. Now, if you were to relax the diaphragm would go back up and decrease the volume of the chest cavity, therefore increasing the intrapleural pressure. So the diaphragm is the primary muscle of inspiration. So the secondary muscles of inspiration are going to be the intercostal muscles. So the intercostal muscles are between the ribs, and they do a few things. So the first types of intercostal muscles can actually rotate the ribs outward. So the ribs will actually sort of rotate like a bucket handle outward, increasing the volume of the chest cavity. Other intercostals can move the sternum slightly outward, like a water handle, and therefore increase the volume of the chest cavity. And during this process of contracting, the intercostal tissues are going to stiffen in order to prevent the chest cavity from collapsing in on itself. So what about exhalation? So exhalation, it's important to realize that there are no primary muscles of exhalation. Exhalation is going to primarily occur by relaxing the primary muscles used during inhalation. So this would be like relaxing the diaphragm, relaxing the intercostals. However, accessory muscles, which are muscles besides the intercostals and diaphragms, can be used during forced exhalation. So in this video, we talked about how the elastic forces occur in both the chest cavity and the lungs, and how the interaction between these two forces produces intrapleural pressure. We talked about how intrapleural pressure can vary at different points, and we talked about the different muscles that govern the inhalation process. And we also talked about a little bit about how accessory muscles can aid in both forced inhalation and exhalation. So I hope this video helped you understand what intrapleural pressure is, and I hope to see you in the next one. Thanks for watching, and I hope to see you next time.